Well, good morning, everyone. January 18th, 2023, and welcome to our UCCCN meeting.
Thank you.
Here is what it's going to look like. Yeah, come on, Mindy. There we go. For those of you who are on a few minutes ago, I said it's going to be a little bit of a different meeting in terms of the order of things this morning. So bear with us. This won't be how we do it usually, but Eric Christensen doesn't have much time this morning. And so we're going to give him kind of the first up slot, and then we will move into our more normal, more typical order of things. But we always start with introductions. So let's do that. Oops.
So Mindy,
there we go. Yeah.
Mindy, can you go back to the agenda?
Mm-hmm.
I do not see UPIQ and my name on.
Oh my gosh. Thank you. Oh my gosh. I tell you. Yeah.
So
okay, no worries.
My feelings are a little bit hurt, but
yeah, they should be. You should take me to task for that. Okay, very good. We'll have UPIQ
a few minutes. I just need a few minutes. Yeah.
Yes. Yeah, absolutely. Right after Dora.
Okay.
Yeah. Okay. And I will modify that agenda before it gets posted for, the permanent record. Okay, we're flexing. We're going with the flow.
There you go.
Thank you for pointing that out right up front. I really appreciate you doing that, Gabi.
Looking out for my own interest, so
I like it. It's important to do that. All right. Well, welcome everyone. And I'm going to go ahead and take a look at our list of participants and just go down that list and ask you to either unmute and tell us who you are and where you work and what you do a little bit. And then if that doesn't work for you, if chat works, we totally like our Zoom chat feature, and you're very welcome to use that for introducing yourself and throughout the meeting. So I'm Mindy Tueller. I am the Director of Operations for the Medical Home Portal, which is a resource for anyone who cares for children, particularly those with special healthcare needs. I also facilitate this meeting, and I'm happy to say that we are starting our 9th year of the UCCCN group, which is kind of crazy. Michelle, do you want to introduce yourself next?
Yes, hi, I'm Michelle Redfield. I am the Administrative Assistant for the Medical Home Portal, UCCCN, and the Division of General Pediatrics.
Thanks, Michelle. And Gabi.
Hey, my name is Gabi Baraghoshi, and I am a quality improvement coach here at UPIQ, which is the quality improvement organization under the Department of Pediatrics. Thanks.
And Gabi will be speaking a little bit later.
Thanks for the confirmation.
Absolutely. All right, Tina.
Hi, I'm Tina Persels. I am with I'm with the Medical Home Portal, and I'm with the Utah Parent Center, and I serve basically as a family voice and a consultant for families of children with special health care needs. And I'm a mom too.
Absolutely. And Tina will be talking with us later as well. Cassie Crane. So we got a chat. Cassie says, hello, Cassie Crane, Medical Home Coordinator for Wasatch Pediatrics South Point. We're very glad that you're on with us today, Cassie. Dora.
Hello, my name is Dora. I am a physician referral liaison. My title has switched. What I do doesn't, but that encompasses a little bit more what I do. So I make sure that your clinics are connected to Shriners and make sure you're taken care of for Utah and all surrounding states.
Fantastic. And Dora's going to talk for just a minute today as well. Excellent. All right, Amy Boyd.
Hi guys, I'm Amy. I am a QI coach for University Development Assessment Clinics. I'm over particularly the Aspire project, which is an autism related project. And then I also spend a little bit of time with the UPIQ Prescription for Play program. And I am also a mom of 2 special needs and a recovering cancer kiddo. So
You bring a wealth of experience, Amy. I'm glad you're here. Daniela Ramirez.
Hello, I'm Daniela. I work at University Pediatrics, and I'm a care coordinator here.
Wonderful. Glad you could make it today. Next, we've got Ashley Dunham. And Ashley may not be able to unmute. Ashley, if and when you're able, please go ahead and put something in the chat about yourself. All right. Eva Allen.
Hi, I am new. This is like my third or fourth week, but I am Daniela's other half. She's not going to be doing all the work here at the University Pediatric Clinic. I'm a care coordinator, so we'll be able to split up the work and take on hopefully more. So yeah, I'm so excited to be here and be part of the team.
Welcome, Eva. We're very happy that you've joined UPC, and we hope that this meeting will be a resource for you. And we are so happy that Daniela has some help. That's great. That is terrific. Welcome.
Thank you.
Evelyn. We got a chat. Evelyn is with Utah Valley Pediatrics Cherry Tree office. She is the care coordinator there. It's nice that you're joining us, Evelyn. We always like having you on. Terrific. All right, Heather Carlson. Let's see. Heather puts in the chat. She is nurse care coordinator with the Department of Health and Human Services in Eric Christensen's integrated service program. She is in Northern Utah. We're so glad you're with us, Heather. Heidi Bates.
Sorry, goodness, can't find the mute button. I have a little bit of a cough too, so pardon if I get that. But I'm Heidi Bates. I work with Gabi in UPIQ.
Excellent. Glad you're with us. And we got a chat from Ashley. Ashley Dunham with the Office of Substance Use and Mental Health with the Department of Health and Human Services. So she oversees the statewide IDD and mental health services. And we really like that she is joining us for these meetings. So welcome, Ashley. Jade.
Hi, I'm Jade with University Health Plan's Healthy You Medicaid. And I'm also a mom with twins and young teen twins and a 9-year-old.
Jeez, Louise, I don't think I knew that, Jade.
Oh, and I have to leave at 9. Our staff meeting's at 9, but I'm glad to be here for a minute.
Excellent. We're always happy to take whatever time of yours we can get.
Oh, thanks.
All right, Julie Southwick.
Hi, this is Julie Southwick. I'm with Eric's team. I'm a transition coordinator.
Welcome, welcome, Julie. And Julie's a mom.
Yes, I am.
You are. All right, Mindy Butters.
I'm Mindy Butters. I'm a care coordinator at Utah Valley Pediatrics, the Brooklyn North main office.
Lovely to have you on the meeting, Mindy. We've missed you.
I have missed all of you guys, so I figured if I do this in my car, I'm safe and nobody will interrupt me.
So smart. Just stay warm.
Yeah.
Stay warm and stay safe. All right, Natalie Carter. Okay, we got a chat. Natalie says she's the CSHCN coordinator in Central Utah with Eric Christensen's ISP group. Welcome, Natalie. Glad you're joining us this morning. And next we've got Rebecca Chilino.
Sorry, my mute would not get off. So my name is Rebecca Chilino. I'm a care manager at the University of Utah Farmington Clinic in the family practice. We also have pediatrics.
That is so great. We're really pleased that you're joining us. That's fantastic.
Thanks for having us.
And someone with just Stacy. Stacy as first and last. And Stacy, if you are able to put your information in the chat, we would love to know a little bit more about you. All right, I think I've gone through the list and I see that Eric has joined us. So Eric, do you want to introduce yourself?
Good morning, Eric Christensen. I'm Program Manager at Utah Department of Health and Human Services Integrated Services Program. My apologies if anyone knows how, what, when, where, or why computers do what they do. I'm ready to sign up. It took me 20 minutes to try to get the computer to reboot this morning, so I apologize for being late.
No problem. And you know what? I'm gonna pass the mic to you in just a moment as well. So,
well, and Mindy, my meeting got canceled this morning. My other one, we had 2 people out of the 4 that were sick this morning. So
okay,
I'm here for the whole thing. So
fantastic.
I'm happy to talk whenever you would like, but I don't need to wiggle the agenda at all either. So
okay, that's great. Well, then we'll flip back to a more typical format.
Yeah, that works fine.
But just so you know, I completely forgot to put Gabi on the agenda. So you are in great company this morning.
Oh, great.
I'm gonna be paying for that for a long time. I can tell you guys that.
Oh,
right
yeah, the stepchildren.
Oh my goodness, so not true.
So
all
not
right, so as we always say, we encourage you to try and join us on a computer, a laptop, or a desktop, because that seems like that's the most rich experience for Zoom meetings. But we'll again love it if you'll join us in any way possible. In your car is great. We'll try and end promptly at 10 o'clock or before, so that you so your time is respected. Oh, good. And Stacy has put in the chat that she's Stacy Barnes with Utah Valley Peds Saratoga Springs. Welcome, Stacy. Wonderful. All right. So I'm going to skip past this for just a moment. We'll come back to those, and then we'll move into what's a more typical flow for these meetings to do some announcements. And I'm happy to let you guys know that we are making strides on a couple of the things that came out of the survey that we asked folks to do last fall about what they'd like to see from this meeting and this group. And so we heard that professional development and even continuing education, if that's possible, is something that would be desired. So we are working first on the professional development front. So if you're able to continue to attend, that will turn into something that we can acknowledge. And we're planning on having more details about that shortly. But the efforts that we've been making in the last little bit have been around this new private Facebook group. So we've got that started. And what we'll plan on doing after this meeting is invite you all to this Facebook group, which is invitation only. And if you don't like the email address, you don't want to use the email address to join the group that you're using to interact with us as a UCCCN member, you can just let us know and we'll resend to whatever email address you prefer. You don't have to do this. There's no obligation whatsoever, but our hope and our goal is that it becomes a place for you to interact and network between meetings, ask for help with cases, mention new resources, any of those kinds of things, QI stuff that's going on that you'd like to share or ask about, all of the above. And the other thing that we'd really like to encourage you to do with this as well is to talk about what's going on in your own world, anything that you're struggling with, because we recognize that you guys do so much. So many of you are moms, as well as having this professional responsibility that can be very stressful. And, day after day, you're working with folks that have serious issues, and that's a lot to take on. And so we want this to be a place where you can be supported and feel supported in your own journey as well. We will have some moderators, and I'm happy to say that Heather Carlson, Heather will be one of those. So she will bring her knowledge of resources for children and youth with special healthcare needs in Utah, she will be able to help with that. And we'll be watching for, PHI and those other things, but we're happy to say that because it's a private group, we have a little more latitude with that. So again, watch for an invitation. The Facebook group is findable on Facebook. So if we're taking too long, you can look for that and ask to join, and that works just great as well. But yeah, there is an administrator who needs to, allow you to join in all of that. So we'll see where this goes. We're excited. We'll hope that that's a new tool that's of use to all of you. All right, so just a quick update on Pediatric Project ECHO, which some of us on the Medical Home Portal and UCCCN team are also involved with. Dr. Jennifer Goldman is the lead mentor for the University of Utah's Pediatric Project ECHO, and our spring 2023 session has begun. Does not feel spring-like at all out there, but nonetheless. And so we liked the motivational interviewing presentation that Drs. Merrick and Wakimoto did for UCCCN last November. We liked it so much. We invited them to come and do it for this more physician level audience, and they did another great job. And so that was last week. This week, later today, we have another one on neonatal seizures. And then the next session after that, on the 1st of February, will be on youth suicide prevention. And we have a packed spring session. Pretty much every Wednesday at noon, we will be doing some kind of Project ECHO presentation, and we encourage you to check those out. Attend if you're able and interested, and if not, know that those recordings are always going to be posted really quite quickly on this link, and that link will go out in our meeting summary. All right, some medical home portal updates. We've got some new content we want to make you aware of in the family section. We've got some information on ways to improve your child's sleep and some safety precautions for children with seizures. We've also got some clinical content that's been updated, and that includes the toilet training for children with complex medical conditions. It includes boosting calories for babies, toddlers, and older children. Febrile seizures, that's been updated, and then evaluation and management of first unprovoked seizure has been updated. So as you can see, we've been working in the seizure related area a fair amount. All right, so now I'm going to step back a little bit and remind you that we always want to hear from you in these meetings. So if there is anything that you'd like to bring up and mention with regard to cases that you're working on, resources that you've come across, resources that have gone away, really anything. This is your time. We love to hear if you've had an opportunity to use any motivational interviewing techniques, if you're working on any QI projects. And again, just like we said before, if there's anything that you want to talk about that you're just struggling with in your own career, etc., this is your time. So I'm going to be quiet for a few minutes and let anyone who wants to put something in the chat or unmute and talk.
I feel silly. Oh,
go ahead.
I'm sorry. I feel silly asking this, but a couple of my trainers didn't know what motivational training is. Is there a way to briefly, or motivational interviewing, is there a way to briefly explain it really quick?
Well, Eva, it's great that you bring that up, because as part of what we're planning on doing this year, 2023, we're going to include a new part of this meeting called our MI Minute, where we talk for just a moment or two right after the brainstorming part about motivational interviewing, because we recognize what a valuable tool it can be. And so I would be delighted to try and talk a little bit more about it. I am by no means an expert, so if anyone else wants to get prepped and ready to take that on, that would be great. But yes, we'd be delighted to spotlight that a little bit more for you.
Okay. Is it okay if I?
It is, Tina. Go.
Okay. So I want everybody's attention and brainstorming here, and ideas and anything else. So I'm diving into some huge advocacy currently. I've been pushing it for about 3 years, and I finally got the attention of the Disability Law Center, and they wrote us into our budget and made and assigned a lawyer to the project. This has to do with a very small population of adults who currently receive services from the technology dependent waiver, or what you might have heard as the Travis C waiver. They renamed it a few years back. It used to be Travis C. Not a lot of people know about it. I've been trying to get, public attention, and any Zoom I'm on, any meeting I'm at, I bring it up because it's super important. But we've got currently, so the tech dependent waiver is intended for people who are on technology. It is not the same as the DSPD waiver. It does not provide the services that the DSPD waiver supplies for families. It is a great benefit, but it was intended years ago when it started to get kids with tracheostomies out of the hospital. That was the intent. That was the advocacy. The constituents were there to, prove their point and all that. So it became the Travis C waiver. Back when this was started, closer to the 80s, I believe, our kids were not surviving. There have only been a minimal amount of slots on this waiver. When my son Adam was actually accepted onto the waiver, there was not a wait list. There were 100 slots, and the only way you got in was if you had a trach, or there's a list of things there. And generally in today's world, it's mainly kids that are being accepted now that are trachs and ventilators. We now have a wait list, and now we have 150 slots. What that tells us is that our young people are surviving. That particular waiver was the get them home so they can live the best life they can for as long as they can waiver, which is wonderful. It provides nursing. It provides family counseling. Those are the two services that are relevant for the tech dependent waiver. Several years ago, it was originally for up to age 18, and they had a young lady who bypassed 18 years, which makes me get goosebumps. And they said, oh no, what do we do now? And so what they did was they wrote in that, if you have been on the waiver and you become an adult, you stay on the waiver. It's just, you don't get, you still receive services throughout your lifetime. And again, for some individuals, that means maybe a little bit longer, maybe forever. It just really depends on that individual and how well their health has improved or changed. Currently, we have 30 adults now that sit on the tech dependent waiver, and they have zero access to adult services. We're an employment first state. They have no access to employment or employment, pre-employment, anything like that, because of the level of care. Now, you might imagine someone who is on the tech dependent waiver as somebody who needs to be at home. And this was the intent. Again, the services are 100% at home currently. And so that would look like respite up to X amount of hours per week. And that is very helpful for families, but there's a good percentage of this 30 that are right where they need to be, at home, being cared for, not in a hospital setting. Okay, but these are individuals that would otherwise be in a hospital setting because of their health. There's a handful of that 30 that are not in that category. They are up every day. They are out in the community as long as they're in school, right? Let's say, you know, up to 18 or 22, depending on how long they're in school.
Reese.
Hello? Okay.
You're okay. Keep going, Tina.
And so this handful, and which includes my son, guys, it could be 5, it could be maybe 10 that have the desire and the need to get out there, experience the community, go to a day program, have some employment training opportunities. And it really, this issue cuts into VR services because VR can't do anything for this person. This issue cuts into a lot of things. So my big mouth has been going off for about 3 years now to everybody I can possibly get to listen to me. And like I said, we got the attention finally, and we're moving forward with trying to get the attention of the legislature this session. With that being said, Amberly DeTio is our attorney at the DLC, and she has written up an example letter for families. And so what I'm asking of everybody here today is, if you know of an individual who's 18 plus on the tech dependent waiver, will you please have the family contact me? We're trying to really prove what's going on here. If you really get, I don't want to speak too legal, but I want to say it is segregation within services. It is an Olmstead issue. It is a lot of things. It's just been overlooked for so long that it's time. It's time for these, you know, young people to have the opportunities and the equity that is equal to their peers without tracheostomies. And it really honestly boils down to that one little hole in their neck.
Oh my God. Okay.
Yeah. So this is what I'm doing right now amongst all the other things. And Adam's going to be up at the Capitol, and we're going to try to get the attention. And it really shouldn't be a whole lot of adjustment they need to make. It's a very, very small part of the population. It just needs to be fixed.
Okay.
I've told the state many times over, if you don't pay attention to this, somebody will start a lawsuit against the state. It's going to happen at some point. Hasn't happened yet. We're trying to negotiate at this point in time. So
that's great. Yep, that's great. And I'm familiar with Amber, and this is tremendous. Okay, so we'll put that in the notes. But if you guys have contact with families who have a child over 18 who is on the technology dependent waiver, please have them get in touch with Tina. And it sounds like the sooner the better, because the legislative session got underway yesterday.
Yeah.
Okay, we'll do that. Absolutely. Okay. Fantastic. Great. Okay. And Ashley, I see what you put in the chat, and we'll mention that in just a second. Does anybody else have anything they'd like to talk about for the brainstorming stuff? All right. Hearing nothing. Let's see. Let me pull this up that Ashley mentioned. So it looks like USU is doing their Project Scope again, which focuses on opioid use and, you know, children who are, is not what I want. Sorry, guys. Let's see. IRDPP USU.
Okay,
Project Echo focuses on, opioid effects. So that's great. Ashley, do you want to take just a second and say anything about it?
Period.
No, why I'm not getting there.
Register for this. And I used to always get an email 10 minutes before, but not today.
let's see, if you guys can mute if you're not talking for the meeting, that would be super. And let's see, Ashley may not be able to talk either, so she's having audio issues. Gotcha. Okay. Well, yeah. So this is USU's Institute for Disability Research Policy and Practice, formerly known as gosh, I can't even remember, Center for Persons with Disabilities, and they are wonderful and we love them. And Project Scope actually was happening, I think, a couple of years ago, maybe a year and a half. But here it is right here. Project Scope latest round focuses on toddlers and children impacted by opioids. So this is a Project Echo series, and they do a really nice job. We kind of jumped on board with them when they were doing it last. So we'll get this information out as well in our meeting summary. And thank you for mentioning that, Ashley. Fantastic. Okay. Okay. Let's get back to our slides. And we kind of talked about this already. We'd love to hear about these. And that's a nice segue into our motivational interviewing minute. All right. Well, so Eva, kind of one of the things I've been trying to remember and take away from our motivational interviewing training, which we try and do almost every year if we're able to, in one way or another. And true motivational interviewing training should take probably weeks, right? Not something we can do. But the ultimate goal of MI is to resolve ambivalence. And so that's what I always keep trying to remember. So it's when you're, with a family or with a young person, and it's clear that there is some ambivalence around a behavior or what have you. And so one of the very first components and a very important one of motivational interviewing is to express empathy. So we often have a tendency, particularly those of us who have the knowledge, right, to want to go toward writing the response, meaning you should be doing this, right? Well, when somebody's ambivalent about something, that generally doesn't help. Well, let's face it, none of us like to be told what to do. So in motivational interviewing, the very first thing is to express empathy. And a great way of doing that is through reflecting back what we're hearing. So if I understand what you're saying, it sounds like something, right? Whether this is, substance use is a great one, or maybe quitting smoking is an easy way to show this. It sounds like you might still enjoy smoking, but know that it's not good for you and you're feeling like you'd like to cut down or quit. Does that sound right? So that would be kind of a reflection. And then one of the things that we've heard stressed over and over again is keeping our questions to our patients and their families open-ended, giving them the opportunity to say more. And we can even ask them, can you say more about that? And then that puts it over to them. And if we're expressing empathy while we're listening, then that means they're not feeling criticized or anything like that. And then it's a safe space. So Eva, the goal here ultimately is to help the patient or the family to understand that they want to make a change. And it's not us doing that, it's us helping them to recognize that. And it can take a while. It's not something that happens overnight oftentimes, and the change can be very incremental. So it's about being patient, but motivational interviewing is definitely about listening. And one of the very first ways that we can do that well is to listen and then reflect back to make sure that we are hearing correctly, be empathetic when we do it, and to use those open-ended questions. And Eva, we'll make sure to send you a link to our November slides and recording, so that if you're interested, you can watch that meeting. It was so well done. We had a couple of triple board residents who are doing psychiatry, child psychiatry, and pediatrics, who are very good at this stuff, come in and show us some things, and it was really well done. All right, hopefully you guys can utilize MI in your practice and in your daily lives. Okay, All right, so let's talk about the order of things now. Let's have Dora go next, and then we'll have Gabi go after that, then Eric, and then Tina.
Right.
So, Dora, do you want to screen share or?
That would be great if I could.
Absolutely.
Take a couple minutes here.
Okay. Hopefully you have the ability to do that now.
Share screen. All right. Let's see. Can you see this motion analysis picture?
Yeah.
Perfect. I just wanted to share a couple of minutes. I met with our team in the motion analysis department at Shriners, and they wanted me to share a few things they're working with the families. Oops, did that switch?
Nope.
No, okay. Yeah. And I just wanted to show this picture just so you know what I'm talking about. These are the cameras. So we have a room where there's these cameras. It's the kind of technology they use to make video games. So you can see this picture right here on the right. That's kind of one of the pictures that they capture. And this is the child. They put these markers on the muscles of the child. So you can see the cameras up here. And the floor is actually matted. So when it's censored. So when the child is walking, they're videoing the child, and they are also capturing all the movements. So the physical therapist is the one that does the study. And did that switch over to the motion analysis family paper?
Nope, not yet.
No, okay. New share. Oh, I wonder that's why. Oh, look at that. All right, now that should show.
Yeah.
Motion analysis information for families. Okay. So pediatrists, they study the feet. They can refer directly to that department. It's a referral that they can send right in. But for pediatric offices, if they see a lot of children that have cerebral palsy, so CP, they take a lot of these studies. If they have toe walkers, really any gait abnormality, when they are referred to Shriners as an orthopedic, like we see that they are in-towing, they're seen, and then at that time, an orthopedic doctor sees that, and if they can't capture what the problem is with just watching them, then they usually refer within our own office to the motion analysis center. So like I mentioned, the physical therapist does that study with a tech, and then they take all those studies and they'll sit down with a provider that asked for that. And they'll see what the best thing that they can do after that. So if they can use bracing, or if a lot of the time, some of these kids come with a specialist saying, hey, I'm going to do surgery, but I want you to do this study first. They do it. The orthopedic specialist sits down with the therapist and the tech. They look at all the studies, like, you know what? They don't have to have a surgery. We can have this specific brace and this kind of therapy, and we can, we don't have to have surgery. So that happens very often. Insurance will cover at Shriners. From what I understand, we are the only ones in the state of Utah that does this for the patients for treatment. So the first one, insurance, we usually cover, but we at Shriners like to do it before any kind of treatment, or and after, and then a few months later, and then years after, to see if they're improving or if they're not, and why not. So Shriners go ahead, they just go ahead and they cover that, just because of the importance of having that information. So yeah, technology, understanding. So that's a little bit of what I've covered. And I covered what the Motion Analysis Center is and what they do, and who does it and why they do it. So if do you have any questions? This is a great tool that we have within our own facility. And then this is actually something that they send out to the family saying, hey, your provider has requested this. We will go ahead and get you in. And they're so good at working with children and the families, very friendly. And
there was a recent pediatrics echo done on this. So if anyone wants to see a little bit more of this, that recording is available, and it was really, really cool.
Yeah, they do a great job. So yeah, just to let you know that they do, when you are referring anyone with a gait abnormality, a lot of the times the providers within our own clinics refer so they can see a little bit more of where that's coming from. So yeah, thank you for your time. If you have any questions, you can reach out to me at any time or right now.
Thanks, Dora. We'll make sure your contact information's in there as well. Very, very cool.
Thank you.
All right. Okay, so let's go now to, actually, I'm going to back up and we'll actually go to Gabi now. Gabi, do you want to
share the screen? Yes, I will.
Yeah, share the screen. Let me stop sharing. Oh, I'm not sharing. Great. Perfect. All right.
Can you see the slide? Yeah.
Yes.
Ah, perfect. All right. Well, thanks for putting me back on the agenda. As you will hear it for the next few months.
Yep.
So I am just going to take a few minutes to talk about the prescription for play, also known as the Promoting Child Development Through Play Quality Improvement Project. We are actually starting up this month. And I know I have talked about this in December meeting, but I only, I give the highlights, and now I would like to go a little bit more into details about this project. So what is prescription for play? So a little bit background. So it's about 80% of the child's brain develops between birth and age 3. And as we also know, play is the brain's favorite way to learn. And doesn't matter how old you are, it's always fun to learn through play. So doesn't really apply to children, also applies to, at least to me too. So the main goal of the prescription for play project is to embedding learning through play into pediatric care, basically make it a standard of care that the prescription for play is addressed with the parents. So what we have done is, so we have partnered up with the Lego Foundation. And the Lego Foundation really put out this program about, I would say, maybe 2-3 years ago. And with the intention of making it really part of a well-child visit, that parents and children will get a Lego kit, and education will be giving on the importance of play. But they really kind of, it didn't take off as much as they want to. They lost control over the project a little bit. And so they partnered up with us as a QI project. And so we thought, gosh, that sounds like a great program, and we would love to do it. And so here we are. We kind of packaged the whole deal into a QI project where providers can earn 25 MOC Part 4 credits, nurses, MAs, mid-levels can earn 20 CME credits. We as a QI team will help the practice, to see how can we document this in the EMR, and also how's the workflow, and how can we implement the prescription for play into the current workflow of a well-child visit. So the program is really geared towards children 18 months or 24 months or 30 months. Yeah, that's basically it. So let me go to the next slide. So this is the material we would be giving to the family. So here we have the Lego kits, the Duplo kits. It comes in a little package over here. And then here would be the educational brochure for the parents. It's in English and in Spanish, which is very nice. And just to let you know that how committed the Lego Foundation is for this program. So they already have designed a new kit that comes out in the summertime. So they have to use up all the Lego kits we have right now. But as soon as they run out of this one, we have this little box for the kid and for the parents. So basically, the box itself can be a toy, can be kind of a rattle. Then there is activities around the box and activities inside the box, plus the Lego kits. So let me just go back to this package over here. So here it's called the duck, right? And I have met with several Indian health service systems. And their first response was when they saw the duck, they said, well, I'm glad it's a duck, not an owl. I believe in the Navajo culture, an owl is the bearer of bad news. So I brought this back to the Lego Foundation and says, well, you have thought this through and you put a duck out there, not an owl. And so they said, oh, obviously we did good on that one. I think they did not much research, but it was just lucky for them to have a duck. But for the new kid, there is no really animal, no duck, no owl. So it's really free play for the child. Okay, so if parents are really interested in participating in this project, so the onboarding starts out with me coming, or one of our QI coaches coming to your practice, explaining the project to you, and then also providers have to watch a 15-minute training video, and it's really only 15 minutes long, and that is followed by a 5-question question survey, and this mainly for me to keep track who has done the training, so to put some accountability onto the practice that they are really committed to this project. Then we would do some good old-fashioned process mapping. It's a very quick one, just to, you would tell us what your current workflow is for your, let's say, 24 months well-child visit. And then we would start to brainstorm some ideas on how we can implement the prescription for play into your practice. And then also how can we help you, or maybe help to brainstorm some ideas on how to document that the prescription for play was given to the parents in the EMR, because we gotta keep track of that when it's a quality improvement project. And if it's not documented, it's not done. So that's pretty much the motto in healthcare. Quality improvement project, there are measures. So the first measure would be the providers are getting trained on the prescription for play. And the second measure is improvement of documentation. The prescription for play was provided to the parent, and the Lego kit was given to the child. So we have implemented this prescription for play at 3 university pediatric clinics. So it was the UPC, it was Sugar House Pediatrics, and then also South Main Pediatrics. And so what have we learned from them? So implementing a documentation in the EMR is very important. So here at the university, they're using Epic. And so Dr. Stippelman, who is pretty much an Epic super user, she was able to implement extra text into the 24 and 30 months well-child template. You can see it right here. I put a red box around it. And then just because it's in the EMR doesn't mean the providers will document it. So it's very easy to forget in a very busy well-child visit, because there's so many things providers and MAs and nurses and care coordinators have to address. So what we decided is we're going to put a little reminder card on the package of the duck. So when a provider grabs the package, and also the educational brochure is attached in the back, it at least tells the provider, oh yeah, I should not forget to document that. And actually, it really helps. So as you can see, any new project, right, it takes a little bit time to get off the ground. So baseline was 0, we didn't have the program in place. And then by month 4, we were above goal, so 80%. And December was also 87% at the Sugar House Pediatrics. So it is a fun project. We got some great feedbacks already. And so I know that Cassie is on the call, and on Monday, I met with Cassie and Dr. Bosworth at South Point Pediatrics. They're really interested in participating in this project. And Dr. Bosworth was mentioning, and it really kind of stuck with me. He said, it is part of the well-child visit to tell the parents to decrease screening time, but we never offer an alternative, right? And so he said this prescription for play could be the alternative. We're just telling them, and now we're giving them some options on what to do with the child. And I think that's great, right? I mean, I thought this was a wonderful statement. So if you're interested and need more information, please contact me. or you can, and I know Mindy's going to put this probably in the notes, the registration link. And so we want to, we want to approach every pediatric practice along the Wasatch Front, but we really, really, really would like to recruit some practices out in the rural community. And so I'm so happy that Eric is on and some of his care coordinators like Walter. And so I hope that we can partner with you, that you can help us to have some access to some of the pediatric practices or family medicine practices who are seeing children out in the rural area. And I know, Eric, you invited me to come to one of your care coordinator meetings, and I am looking forward to that one. Okay. Any question about the prescription for play? And I know I've talked very fast, and I'm very passionate about this project, as you probably can tell, but I am opening up for some questions before I move on to the Spark for Autism Study.
I have a comment.
All right.
I know when we talk about play, that it, again, play, it may not resonate with people, sometimes, why is play so important? It really is. And I can tell you, I've got a 23-year-old, almost 23-year-old now, who from birth, that is what we did to build his motor skills, to get those fingers working, to get the ability to point and push a button, to be creative, of course. But when it's pediatric, it's always what's going to attract them the most, and it's going to be that toy. And so that's what we used all through his, and still do use a lot through his therapies to, be able to help him. And as a 23-year-old with cerebral palsy, he has developed fine motor skills and things that have really helped. And I do attribute a lot of that to play.
So that's a very good point, Tina. And since I did the chart reviews for the university pediatric clinics, I have noticed that on normal, I don't want to use the word normal, but on regular well-child visits, it was very well given out to the parents. But if there was a more complex child, most of the time, maybe because they didn't have time to do it, but it was not given to the parents. And in my thought, it was always exactly those children need to receive it because of the fine motor skills and the interaction with the parent. So I hear your point very well.
And even, we did a project at Primary Children's on inpatient and playing, and we saw kind of the same thing. The typical kids were sorry, I'm getting a call from the parents that I'm going to reject that. Sorry. I did not put myself on Do Not Disturb. And so we saw kind of the same thing when a child life person would come in and offer a toy, we would hear, my kid can't play. And it really is about, especially in the beginning, if you're that far off and you think they're not able to play, then you play with them / for them, hand over hand. You teach them how to play. And it really is, for some of the more complex kids, very, very important to learn that. Okay, I'm done.
No, good. Not to cut you short, but I know that we have other people who would like to talk to. And so I really quickly want to spend a few minutes on the Spark for Autism research. And we are mentioning the Spark study at every UCCCN meeting. And I just want to give you a kind of a few highlights and maybe a short update on what we are doing. So the Spark for Autism research. So the greatest news is that's now available also in Spanish. And so we are hoping that we're going to recruit now more Spanish speaking population in primary care, because before they always have been left out, right? And now, so we finally opened the door. The whole registration process for them is also in Spanish as the consent form. And we have a Spanish speaking study coordinator who can help them with the registration process. So that is the biggest news and the most positive news. So there might be still some people in our audience who might not know what Spark for Autism is, which is hard to believe, but there still might be one or two out there. So what is Spark? So Spark is a free online study with a simple mission to speed up the research and advance the understanding of autism. So Spark is available for everybody who lives in the United States and has a professional diagnosis of autism and their family members. And so basically, we are trying to recruit the person who has a diagnosis for autism and the biological parent and one of the siblings, if there's a siblings available. So joining is very, very simple. So basically everything is done at home, at the comfort of your home. You register online. You invite the biological father or mother of the child. Once they're registered, you will receive the saliva kit in a mail. You do a little spitting contest at home, and then you're sending it back. And then if the saliva is accepted by the lab back in New York, then the family receives a $50 Amazon gift card. But just sending back your saliva and hoping to get some genetic results from it, Spark offers much more. And one of them is they're offering webinars to families who have members with autism. And I believe Heidi's on the call. She has listened to several of those webinars, and I have heard they are actually done very well. Heidi, any quick feedback on that one?
Yeah, I find them, most of you know that I do have a son who has autism, and as a parent, you kind of, it's muddled, right? I mean, you're just, these kids are kind of enigmas, and you're trying to find out what works best for them. And I have listened to these webinars, and it just, sometimes the light bulb goes off and you're like, oh my gosh, I can't believe, I didn't try this, or I can't believe this happened. So yes, these webinars are very informational. They're very helpful, but also they have webinars for the providers as well. Usually these are providers giving webinars for other providers. So it's a great resource.
It's a I think so too. Great resource. Okay, so the Spark is, so it's a nationwide research study. It's funded by the Simons Foundation, and I think the headquarters is back in New York. And so there are 31 top research centers who are recruitment sites. And the university, as you can see here, we are a recruitment site. And I am proudly to say that we are #2 in recruitment. So whatever we are doing, we're doing a great job. But then again, my brain kicks in and says, how do we become #1? So what can we do? And that's why I'm giving this little speech to you guys. So let us know if you need some brochures. Before I go into the brochures. So far, there are over 300,000 participants in Spark. And in the last 5 years, since Spark has been, in place, so over 100 genes have been linked to autism. So that's great. That's wonderful knowledge to have and advancement in autism. So if you need brochures, postcards, or have questions, or you have family who need assistance with registering, please, here's our email, or you can contact me or Heidi. We are here for you because our main goal is we want to be #1 in the nation on recruitment, and we can do it with your help. All right, then. Thank you, and I am opening up for questions. I think we have maybe 1 minute to do that.
Any questions for Gabi? Well, Gabi, we want to help you guys reach that goal. I think that is pretty cool. So yeah, typically we will have a slide and a couple minutes at the top of our meetings about Spark for Autism. Didn't put that in today because in my brain at some point I knew Gabi was going to be talking about this, but that information will come up again in our subsequent meetings. So you're always welcome to ask for brochures and information at any point in time in the year. But yeah, thank you, Gabi, for giving us more information about the Prescription for Play project, which is super, super exciting, and Spark for Autism. Very good. All right. Eric, we're going to give you some time now, and I have your information ready to pop up, or I can let you share your screen. What would you prefer?
Go ahead and just put the slides up if you would,
Okay.
please. Thank you.
Let me go back real quick to those here, and I will share my screen. Maybe. Share screen. All right. Okay.
Well, good morning. I am excited to share information on a grant that we received at Department of Health and Human Services. And then I'll share some information about an opportunity that we're exploring between Department of Health and Human Services and Department of Workforce Services. The first one is a preschool developmental grant. It's called a PDG birth through 5. And I put in parentheses actually birth through 8. All over the grant guidance, we were kind of vacillating on whether this is really birth through 5 or birth through 8, and ultimately came to the conclusion it really is from birth through age 8. What this grant does, it looks at enhancing early childhood system here in Utah to ensure that the general pediatric population is connected with supports and services that would prepare children to be ready for kindergarten. The Integrated Services Program really focuses on children and youth with special healthcare needs. And we work with children from birth through age 18, 21, 22, and off the record, I'm going to say we've even gone older than that with some families that have reached out to us, and we've helped those families and then try to get families to, with older members of the family into adult care coordination or adult care, that we would never probably say no to someone that had someone with special needs that needed some care coordination. But ultimately, we work with generally birth 18 at 21. This grant is a slight offshoot from that in that it focuses on the general pediatric population and really has a focus on birth through 5, but would go up birth through 8. And what we're looking at in a nutshell, there are several initiatives within the grant, but probably the piece that is going to be closest to home for most of us, and specifically for integrated services, is this grant is going to allow us to hire 3 new staff within the integrated services program. We'll have a program coordinator that will help to collect data, provide some supervision and training for 2 in-house care coordinators. And then 6 local health departments have agreed to have a birth through 5, birth through 8 care coordinator in their office. So that's Central Utah, Davis, San Juan, Tooele, Tri-County, and Wasatch health departments / districts all would like to have a care coordinator that may not be full-time, but at least a part-time care coordinator in their office as boots on the ground to work with this birth through 5 population, with the goal being to connect families to high quality childcare, Head Start, help families with applications and processes, and help these families really get connected to those services that are conducive to getting kids ready for school and preschool and all of those things that help kids learn. In addition to that, they will be providing general care coordination activities as well. As we know, when we meet with families, we have the tendency to kind of dig a little bit deeper when we do care coordination and discover a lot of other things that families need. And so we wouldn't limit it to just, preschool or Head Start or WIC or things like that, but also those other care coordination things that we work on as well. So again, Medicaid, insurance issues, housing, issues like that, possibly helping families find primary care or try to help families find specialty care or what have you. So we're very excited about that. Now, one of the things that's great about this as well, a lot of our local health departments already provide services for children in the birth through 5 age group in the form of like targeted case management. Some of you who work with Medicaid kids know that we do early periodic screening, diagnosis, and treatment. EPSDT is what it's called, which is our well child care. But any kid that qualifies for those types of services would be eligible to receive some of this type of care at that local health department level. And what this does is it expands that care out to kids, not just up through age 5, but also up through age 8. There's a program at local health departments called Targeted Case Management that provides some home visits to kids who qualify for Medicaid up through age 5, but that could also be extended up through age 8. And what's great about this grant as well is it doesn't require that families meet eligibility criteria for Medicaid or some of the other traditional programs. So it provides, allows these care coordinators and other workers within the health department to provide services regardless of program or eligibility criteria that would normally box families or kids into those traditional programs. So again, targeted case management or some of those early periodic screening, diagnosis and treatment programs. We're very, very excited about that. And then several of the local health departments are really looking at using community health workers to provide a lot of outreach in the community, that boots on the ground, door to door, in the home type services for the families they're working with. We know we have a lot of new moms and dads that could use a lot of support. So for example, in Utah County, Welcome Baby program could be extended out to a lot more families who are discharged from the hospital, the NICU, whatever, and receive in-home support from trained health department staff. We are in the process now that we've been funded and doing all the work of getting jobs posted and getting contracts in place. And while this is not fully actionable at this moment, we anticipate in the next couple of months we will have those positions going and the local health departments will be hiring. And I'd say probably by spring, this will be in full motion. Any questions on this slide? Anything we can answer for you up to this point?
Eric,
right,
what
was that, Tina?
Sorry, are you using that state community health worker training to train these new employees?
Well, you know, a lot of the local health departments have community health workers already employed in the system. And so they will utilize community health workers that they have and probably bring folks on. And quite often that state community health worker training is the pipeline into those positions. So I will expand on that one a little more for you, Tina, on the next slide. So anyway, we'll be really
training people at the Parent Center on that training too. It's really easy. We just had 3 people graduate yesterday.
Fantastic. Yeah, so it's a great training and definitely prepares people for this type of a thing, for this type of a workforce. So definitely workforce development. And then if you can show that next slide, Mindy, this is just one that we're exploring right now with the Department of Workforce Services. There's the Federal Office of Refugee Resettlement provided money to the state of Utah in our Office of Refugee Services through the Department of Workforce Services, and they're looking at through integrated services, we would hire 4 to 5, more than likely community health workers, but hopefully from within the Afghan population. Some of the Afghan refugee folks went through the community health worker training, and it would be a similar type of a focus for these workers as our Birth Through 5 grant, that they would work with approximately 100 Afghan refugee families who came into the state approximately 15 months ago. And we would work with those Birth Through 5 children to ensure that they are connected with all things early childhood and provide culturally appropriate, sensitive, and in their language services to orient families and make sure that they really understand how to get kids enrolled in Head Start, high quality childcare and services like that. We don't have all the nuts and bolts in place on this one, and we may not come to fruition entirely. However, we are really pushing to have this come into place, and we anticipate that if this does happen, we'd have this going as well in the next few months. And the bonus here would be all of these folks will be coming to UCCCN and tapping into your expertise and sharing their information with you as well. And I will leave it at that. And we're pressed for time, so if you have any questions, I'll put my email in the chat. But if you want to reach out and have any questions on either one of these, please do so. I'd love to share more information as it comes available.
Thank you, Eric. That's exciting. And you are going to be busy. All right. Okay, so Tina, I think you are up. And if you'd like, I'll stop sharing and you can take over. Where did Tina go?
You can start when you cannot start. Well, the other participant is sharing.
Oh, sorry. Yep, there we go. There you go. You should be allowed now.
Where to? Okay. Can everybody see that?
It's just about to pop up on mine. There's some kind of a delay. It's telling me that you've started screen sharing, but I'm not seeing anything but black so far. Is that, oh, here we go. Yep, you're on.
Okay. Well, hello, everyone. I was tasked today with talking about eye health and vision. It's a big subject, of course, but we're just going to talk some basics because one of the biggest issues is, of course, making sure there's eye exams, but also, where do we get the glasses? Where are they affordable? Where all of those things. So let's start out with my little quote that I think I made up because I don't think it's a real quote. But our eyes are our window to the world. We need to take care of them, right? It's super important. A lot of things can happen to the eye, and it can be, something that came from birth. It can be our bad eyesight. Your retina can detach from your eyeball. There are things that can happen to eyes. It's amazing the things I've learned about eyes. But with our children, we don't really necessarily always worry about retinas detaching. So our children's eyes are even more important, and they're part of their health and development. We need to watch them carefully because they're growing as our kids grow. And so there's changes that can happen. A few things, of course, most people do with their kids, but we want to make sure people are watching their kids, eyes for misalignment. It can be really a serious thing if there's misalignment. There are a lot of different things could be happening. So that would be an automatic get them into the doctor. Keep your children away from cleaning projects and sharp objects. Don't let them poke themselves in the eye. Of course, we want to make sure the eyes are protected all the time. And then screen time has become a bigger issue over the past, few decades with eyes. And we are seeing now that we have, a lot more data on eyes and screens that it's really affecting people. Look at helping those kids balance their screen time. It can cause dry eyes. If they do have dry eyes, talk to the doctor about what product to use to help them, with the dry eye. and then eye strain. And that's when you start seeing them squint their eyes and get close up to things. That is a red flag. Nearsightedness can also develop from screens. Kids who spend too long, you know, with screens or doing anything really that's near to their face like this. And I know with my daughter, even though she didn't have too bad of a prescription with her eyes, she was always up in whatever she was doing. And I would have to say, pull the book back. It's too close. We need to look at how you're seeing right now. And then kind of, you know, if you see that kind of problem, you know, look at the book with them and say, okay, now at what point can you actually read it? At what point can you actually read it? So that they understand that they don't have to have their face so close up. And then if you notice injuries or problems with their eyes, schedule an eye exam immediately. With a child, it's really, with all of us, it's really important, to be honest. And so how do we schedule that eye exam? The first note I want to make, because we discuss children with disabilities quite a bit here, is that the basic vision screening is not for everyone. We are going to give lots of resources today for basic vision screenings, but there can be reasons that you're not going to go to that basic eye care place like Target or Eyeglass World or whatever it might be. My son had cortical vision issues, so we had to really work through, and you know, it wasn't his eyes, it was his brain-eye connection that was having issues. So we had to work through that and figure that out. Generally, kids with disabilities are followed closely, you know, by their physician, and their eyes are always looked at, but we want to make sure that parents know, you know, if you have a kiddo that has neurological issues, different things like that, you might want to go a little, you know, there are specialists, of course, up at Primary Children's and at Moore Eye Center that really work with the kiddos that have, you know, more issues than just, you know, what Walmart can handle. And then we've got challenges like autism, intellectual disability, mental health disorders. Fear of doctors is a big one. When you think about it, when you go to the eye doctor, they're right up in your face, right? It's not going to happen with some kids, especially behavioral kids, kids with autism. If they can't speak and tell the doctor what they can see and what they can't see, that's a big one. And so that may not be, you know, the person you want to take to just, you know, America's Best or something like that, because they're not going to get probably the best eye prescription. You want to find somebody who can really work with them. I know at Primary Children's, they worked with my son because he doesn't let doctors get near him, honestly. If he doesn't know you, you are not getting near him. And so they did have tools within the office that would help them to determine a prescription that were pretty amazing. The doctor would stand across the room, and it took a little longer. It took a little more patience, but he had this device that he was looking at my son through, and he was 6 feet away from him. And yeah, and so there are things that can be used. If even that fails, there is the option of putting them under anesthesia, and they can do an eye exam that way. Dr. Hoffman has done several for us under anesthesia. I don't even know if Dr. Hoffman is around anymore, but he was, yeah, he was very open to doing that because it really can get a great prescription for them when, yeah. And so just make sure that, you know, and a place like Walmart or Target may not, they may say this is too difficult of an exam for us to do. And so therefore you would want to look at Moran or somebody that knows a little bit more about how to get a good prescription, even though there's lots of challenges there. And then generally, once you have that prescription, however you obtained it, whether it be through anesthesia or the office, you can go then and take that prescription to, you know, a local, we took ours to Apple Vision, and they had a great lab that we could send them back to if they didn't seem right. But you can take that and have the glasses made. Sometimes a doctor is going to say, I really want you to use this particular lab. I know they're going to get this very thick lens correct. And I'm not sure that some of the, the other places are going to get the specialized pair of glasses the way we want them. And so the medical home portal has a lot of vision screening service providers in the directory, and you can, go to this link and look to find, somebody that may be able to work with a more complicated kiddo. And then for kids who just, will be able to take a regular screening, there's a lot of places that you can go to. I kind of looked up some of the most the least expensive places. Walmart came out really high. I even saw a pair on there that was $11 for the frame. Basic kids glasses. They have yearly back to school sales every year. They usually double it, and 2-for-1 glasses. Target Optical has affordable frames. They have lots of 50% off promotions during the year, and again, the back to school sales. Eyeglass World. I think I should have had that in the other section. Eyeglass World does do a kid's eye exam and 2 pair of glasses for $89. That's all over their website. I think that's just their basic promotion. It's always that way. Glasses USA, they have affordable frames, regular promotions. One thing I noticed, because I'm kind of the clearance queen when I go shopping, is they do have a clearance section, and they're really like 75% off for frames there. The other thing I liked about them is they have a 10-day contact lens trial for $1. So if you've got a teen who wants contacts, you don't have to put out the full price for the contacts. You can trial them for $1. America's Best, 2 pairs. They're all over, Utah. There's a couple places here. 2 pairs of kids' glasses and the free eye exam for $79.95, and contact lenses are pretty cheap for $14.99 per box. Again, the portal has several providers as well for glasses in the service directory, and you can look there for more information there.
Tina, I don't mean to interrupt, but we're just getting tight on time. So if you can do
Yep, I'm running through.
Thanks. Okay.
So internet guys, there's a couple here. I really went into their websites and dug deep. There's Warby Parker Zenny. I know all of you have maybe heard of those. Jonas Paul was developed by a mom and dad who are the parents of Jonas Paul, and he had a pretty complicated eye condition, and so they do they specialize in just kids and teens glasses, 7-day try-on kits. They can send several out. Really neat. Go to their website if you get a chance. And then if there's no other way you can afford the even Walmart glasses, there's 3 assistance foundations here that will do everything they can to get a pair of glasses on that child. And so one note too that I noticed with New Eyes, the last one, is you can donate your old glasses there, and that is one way that they can provide people with a pair of glasses. And so those are the ones that would be no cost if the family qualifies for their services. So one of the big ones, guys, and I forgot to tell you about, and I don't know why it's not here. Oh, it is I Care for Kids Foundation. That's local off of State Street in Salt Lake City, and they're really good. When we have a kid that has no other way to get glasses, take them there, and they'll make sure it happens.
Thank you, Tina. That's great. And we'll make sure that that informational sheet goes out as well with the resources, and that we'll add those if we're missing any of those providers into our service provider directory on the medical home portal for Utah. So, very cool. Yeah, good tips and much appreciated. Everybody, we appreciate your information today. That was great. Well, we're almost at 10 o'clock, so we'll just let you know that our next meeting will be on February 15th, and we hope to see you there. We also hope to see you on the new Facebook group before then, and those invitations will be going out. And don't forget that you can always use our listserv in between meetings as well. It's a great way if you're looking for help to reach out quickly and get responses quickly. You guys are always terrific when somebody's asking for some help that way. And we will plan on getting the resources of the month out quickly, and also those invitations to the Facebook group. So thanks everyone. Have a great rest of your day and the month. And we hope to see you again next month on the February meeting. Take care, everyone. Bye-bye.